Hey everyone, I'm Dr. Eric over at Serenity Smile Designs, and today I want to talk about the consequences of not getting your dental work done in a timely fashion. Now I know there's a lot of barriers to or reasons why you don't want to get it done. A lot of times it's fear, money, dental insurance, things like that, but I can assure you all of those things only get worse as time goes on. Dentistry unfortunately gets more expensive the worse things get. Pain typically gets worse. Also, the more time goes by until things are treated. By treating things early, which is what we like to do in our office by being proactive, we can catch things before they spread. For example, a cavity that's early, it's typically in the outer layers of the tooth where we can really preserve a lot of tooth structure and address it before it gets into the deeper areas of the tooth, which is where the nerve is. Now, once we get to a point where the cavity has reached a nerve, well, now we're in for a root canal. And now is when you start to feel things, and now is when sometimes now it's a much bigger deal. So I always encourage people to get things done before they start to hurt. Once we get into a root canal, and then people still put that off occasionally, well, now unfortunately, that infection can now start to spread into the jawbone. And the issue with infection into the jawbone is now sometimes you're going to need antibiotics. You may need to go to the hospital. And last thing you want to do is have that type of issue on a weekend or a holiday. Because in any dental office, it's not just the dentist that's going to help you. A lot of times we really rely on our team to be available. So if you call on a weekend, Friday, Saturday, even if the dentist is available, that doesn't mean his teammates are as well. So we may not be able to help you until Monday or when you get back from your trip. So unfortunately, I get a lot of calls on the weekends and there's just not much we can do. Antibiotics will not cure a tooth. They sometimes will kind of hide the pain for a few days, but ultimately it'll come back. Pain meds, a lot of times also won't really help you because unfortunately the problem is within a tooth. So a lot of pain meds can't make it inside the tooth to where the nerve is. So unfortunately there's not easy solutions without addressing the actual problem. So my biggest and best suggestion is to try and treat things as early as possible before things lead to infections and tooth loss and even sometimes hospitalizations. So strongly encourage you to get things done as soon as you can. Thanks.